Hi, my name is Melissa Tippett, and along with Victoria Bolton and Jeremy Levitt, we will be telling you about RSV, which is respiratory syncytial virus.
Hello, my name is Victoria Bolton, and along with Jeremy and Melissa, I'll be assisting with the presentation on RSV.
Hi, my name is Jeremy Levitt. Our group is doing the RSV virus. Our group was given the disease respiratory syncytial virus, also known as RSV virus. This virus was discovered back in 1956 by Morris et al., who was working with a group of chimpanzees and noticed that some of them had a virus in their respiratory system. Thinking this was only isolated to the chimpanzees, they called this virus chimpanzee coryza agent. But later, after seeing some of the people that were helping the chimpanzees also getting the virus, they realized that it also formed in humans. So they later changed the name to respiratory syncytial virus. The word syncytium means multinucleate of mass protoplasm produced by merging cells. Some of the causative agents of RSV is first, it produces giant multinucleate cells. Second, it also has a single strand of RNA, perimyxovirus. It's in the same family as influenza, measles, and rubella. And outbreaks of RSV happen worldwide. It is not isolated to one part of the country. And then the peak season of RSV is from winter through early spring.
So the RSV virus can be manifest in many different reservoirs. The original RSV virus can be manifest in man, cattle, goats, and sheep. However, there's been a mutation to the RSV virus started used in a laboratory setting, and so we included it here just to help you see that it can also affect these other animals, that they can also show signs and symptoms of the disease. And so in addition to using cattle and sheep to determine a vaccine, they've also used cotton, rats, chimpanzees, and mice, just as a way to determine different cures for the disease. The signs and symptoms of this virus. So older children and adults don't usually get the symptoms as severely as a geriatric or pediatric patient, just because geriatric and pediatric patients tend to have a lower immune system, and so it's harder for them to fight off the different symptoms. But in older children or adults, it causes upper respiratory tract infection, and the symptoms are similar to a common cold. And so that includes a stuffed up or runny nose, a sore throat, mild headache, mild cough, and a slight fever. And then in younger children and infants, as mentioned earlier, it's similar to older children, but young children and infants can, in addition to developing an upper respiratory tract infection, also develop an illness in the lower respiratory tract. And as a result, they can develop low oxygen in their blood. And so this results in them having a higher fever than the older children or adults, severe coughing, wheezing, and they usually have rapid breathing or difficulty breathing. And then they have a bluish color around their lips and around their mouth.
Clinical manifestations. RSV leads to acute lower respiratory tract infection and causes several symptoms such as wheezing, cough, fever, and severe bronchiolitis in infants, immunocompromised individuals, and the elderly. Additionally, studies have shown that children who contracted a severe case of RSV had problems with wheezing later on in life. Treatment. Close watch regarding the progression of the patient's condition, along with the administration of intravenous fluids and oxygen, has been the overall option of choice. Additionally, bronchodilators have proven to be beneficial to some patients. Infection rates of RSV. RSV is a leading cause of morbidity and mortality worldwide in children aged under 5 years and adults older with acute lower respiratory infections.